time and thinks about these things. This is the first time that I actually really stopped and paused, said, I don't know if I want to get this vaccine. And not until maybe a few weeks ago, when it became clearer that the vaccine was going to be offered to individuals working in my department, that I say, okay, so what is my actual concern here? It's all the time and thinks about these things. This is the first time that I actually really stopped and paused, said, I don't know if I want to get this vaccine. And not until maybe a few weeks ago, when it became clearer that the vaccine was going to be offered to individuals working in my department, that I say, okay, so what is my actual concern here? Because as John said, I have traveled to various places in Africa, and not once did I ever say, well, what's this yellow fever vaccine that I'm about to get? Whatever vaccines they said I needed, they just shot me up, all of them. I wanted to be protected from anything and everything without really questioning whether or not it was going to harm me further down the road or if it was going to be effective. I trusted. I think what the difference is this time is the world that we're living in, especially in the US right now, where this current administration has just put out so many falsehoods and made it very difficult to believe a lot of things. Knowing that they were backing it, I think really took a toll on me and perhaps on some of you as well. We also know our history of not trusting the healthcare that we receive sometimes, or healthcare systems, or the science behind some things, and the way that we've been used and abused over time. But I really had to stop and say, what is it that's going on with you? Why are you resisting this vaccine? And I had to come to terms with it. It was just the way that it was being messaged to me, the way I was receiving the message, who I was receiving it from. And then to take the feelings out of it, my initial feelings, and start getting some facts. So again, facts were being presented to us through our department, through our chair, through our cancer center, through all the different entities that I work with on a professional basis, so that we could present facts to our patients and tell them what they need to do, what they need to consider, what the concerns are. And I'll tell you a little bit about that for cancer patients in particular in a second. But once I started getting the facts and understanding that this was not necessarily a rushed process that they went through where they're skipping steps, I felt much better about the situation that we're in with this vaccine. And then the most important thing is that as the clinical trials have shown that it is safe and effective, and that's important. But I definitely was one of those people saying, I'm not going first. I want to see how other people respond to this vaccine. And other people have gone, and they're fine. They're doing well. So that definitely puts my heart at ease. And I definitely feel comfortable. Again, I am a person who advocates for vaccines. This one just kind of threw me a little bit, and I wasn't sure. But now I feel better knowing that I will have additional protection, because when you wear your mask, you're washing your hands, you're social distancing. I do all of those things, and hopefully all of you are too. But this just adds on another layer of protection. That's how I see it. And that's how I've seen every other vaccine that I've ever had, and that I make sure that my kids get all of their vaccines. And for the same reason, it's an extra level of protection. It protects me, and it protects those that I'm around. So that's why I have decided to go ahead and get it. But I really had some soul searching to do, and thinking about what's the best thing for me. And again, getting the feelings out of the way and thinking through this logically.
Okay, well, before you go to some questions, there's a couple of questions that was put in here, and then after you answer these, then you can go ahead with some of the questions that was presented earlier. It says, one person says, I took the flu shot for 4 straight years, had an allergic reaction every time. Was told by the doctor that if this person decides to take this vaccine, that the doctor would have to keep a close eye on them. what would you suggest?
Yeah, so since you had an allergic reaction already, you definitely want to be careful. You know, there are a few cases that have arisen with people in the US and in other countries that have had allergic reactions. So one of the things that we're told now is that if you have a history of allergic reactions to vaccines, you might really want to be monitored, be careful, tell the person who's vaccinating you. All of us, when we go and get this vaccine, it's mandatory that they keep us there for at least 15 minutes afterwards to monitor and make sure we're okay. So they're being overly cautious with this, and that's a good thing. Okay, you won't be able just to get up and walk out. So if you start having difficulty breathing, break out in a rash, have heart palpitations, anything like that, they're going to be able to detect that, hopefully, if it starts within that time frame. And beyond that, we really haven't noticed anyone who so far has had allergic reactions has happened pretty immediately. So that's a good thing that they're keeping us all there. But I'm glad that you reached out to your doctor about it. And this would definitely be something you want to make sure that the person vaccinating you and that whole staff there realizes that you may be someone they have to keep an eye on.
Okay, and then there's another question, and then you can go to the questions that I submitted. It says, how do we determine whether to get the Moderna, AstraZeneca, or the Pfizer vaccine? How do you determine which of the three do you get?
Yeah, so let me just start by saying they're equally effective. They're equally effective based on the clinical trials. And it probably doesn't come down to you. It probably will come down to what's available at the site where you go. That's what they're going to give you. Okay. So there's not one that's better than the other. They don't work any differently. They're going to pretty much give the same degree of protection, and it's just what's available.
Okay.
Is there another?
My reaction was flu-like symptoms for 5 to 7 days every time. Uh, that was the reaction. I guess the person that mentioned about the flu reactions, it was 5 to 7 days later.
Okay. Yeah, and that's typical for some people, especially with the flu. Your reactions, hopefully, to the vaccine, that does happen on occasion with some people. I've had that happen to me as well, but not every time. Not every time. But I do recall a day or two after having my vaccine feeling a little drained, um, little stuffy, that sort of thing, achy. Those things can happen with lots of different vaccines, and that's your body really responding to the immune system really revving up. But yeah, for you, it's definitely something you want to make sure you mention and that you're monitored.
Okay, and another question is it better to get the vaccine through private doctor or one of the um, uh, various spots that may be administering the vaccine? Does it matter?
I don't think it matters, but I think a lot of the private doctors don't actually have it yet.
Okay.
Um, the rollout has not been great, as you all have heard. There's a lot of confusion about what's going on and who has what. So I don't believe my doctor has it yet. So typically they're sending people out to various sites where they are administering vaccine. And I think that's how it will go for a while. So when I get mine on Tuesday, I'm actually going to my hospital where I work because I'm required to. They want to kind of monitor who's getting it and who's not. We don't have to get it again, but um, it just depends on where the rollout is happening. And if your doctor has it, then that's great. But the thing is, and I don't know if it'll be any different if you go to your doctor's office. If you go to one of the sites that the health department makes available, it will be free. It should be free anyway. It should be free to everyone. So you just want to make sure you're not incurring additional costs by doing it outside of that. But I think it should be free regardless of where you go.
Okay, two more questions in the box, and then I'm gonna let you respond to some of the questions from yesterday. One question was, if an individual has asthma, should they get the shot?
Yeah, so I think so. I don't think asthma is going to be something that is a contraindication for getting this vaccine. The actual clinical trials included individuals with asthma and with lots of other comorbidities, and they seem to do just fine. So again, if you have a concern like this though, I always tell people, I'm not a physician. Speak to your physician first. Tell them you're thinking about getting a vaccine. You have asthma, they already know, but it should not be a contraindication at all.
Okay, and since your field of study is cancer, what would we tell individuals who may have cancer, have battled cancer, about this vaccine?
Yeah,
What would be your recommendation?
absolutely. So for people who are currently in treatment, they are typically immunocompromised, perhaps, depending on the treatment they're receiving. So they may hold off for a little bit. Again, something to talk to your doctor about. It's a little tricky because these are also individuals that are extremely vulnerable if they get coronavirus, right? So you just have to be careful that those should be individuals that talk to their doctor about what the next step is. If you have already had cancer, I've had cancer, you know, if you've already had it, you're a survivor, you should be fine to go ahead and get this vaccine. And that's what we tell our patients.
Okay, so now you can go over some of the questions that were submitted.
Okay, let me find those.
Or you can do it, or I can rattle them off. It's up to you.
I think I have a few of them written down, so let me just see. If I've already had the virus, should I take the vaccine? So from what I'm understanding about this, what we're telling people is yes, you should consider getting the vaccine. Although you've had the virus and you have likely built up some antibodies that will help you fight it if you are reinfected, it's not clear how long the antibodies last, either from natural immunity because you've had it, or even from the vaccine itself. When we all get the vaccine, we don't know if we'll have to get it every year like we have to do with the flu vaccine. So that's still under investigation, but you should definitely still consider it. But timing, from what I understand, might be everything. So if you just had the infection or the virus, you're just getting over it a few weeks ago, your antibodies might be good for a while. You might want to wait a little while before you get the vaccine. But again, something to discuss with your doctor. But yes, you should actually consider, even though you've already had it. Not unlike what happens with the flu. Somebody get the flu, but you can get the flu vaccine later on and protect yourself going forward. It's the same idea. Okay, any questions about that? We're good? All right, so how does a vaccine affect those with pre-existing conditions or autoimmune diseases? So the actual clinical trials included lots of people with different types of comorbidities. So those with asthma, with heart disease, diabetes, obesity, all those different types of people were included. That's the purpose of doing the clinical trial in phase 3. And all those people did well with the vaccine. So it seems to be safe and it seems to be effective for those individuals. The ones with autoimmune diseases, HIV and perhaps some others, again, this is a vulnerable population. I would advise you to talk to your doctor before going to get the vaccine, because it may be useful for you to be vaccinated, but depending on how your immune system typically responds to such vaccines, I think that's really the issue. So talk to your doctor about it before going forward. Okay, there's one here.
Is it, you talking about this in the chat?
The chat. Do you want me to go through the chat too, or?
Yeah, I do the chat and then you can go and continue. So after you do one more, then I'll come back to this question here.
That's great. All right. The common side effects of this vaccine, they're just like for other vaccines. So you might have some pain and inflammation where you get the shot in your arm, feeling a little tired, muscle aches, maybe a headache, maybe even a slight fever, but it's nothing that should persist. Okay, it should last a day or two, maybe. If it persists beyond that, there's something else going on. So you've contracted perhaps something else, but that's all that the vaccine should do. So it's not that you won't feel anything. Most people actually don't have anything going on, but you might have some of those symptoms, and you shouldn't be concerned if they only last a couple days.
Okay. Now the question here was, is there any data that shows which vaccine is less allergic to those with asthma?
Definitely not specific to asthma, but just less allergic in general. I think they both have the same degree of effectiveness, and I'm not sure if there's one that may cause more allergic reaction. I'm not certain about that. I haven't heard that. But again, most the allergic reactions that people have said have been quite rare, which is a good thing. And it's not clear if those were Moderna or the Pfizer. I'm not certain.
Okay. Now, one of the questions from the list we talked, that was sent earlier, which specific precautions or steps should people with known allergies take? And are there any concerns for those with severe allergies in relation to the vaccination?
Now, if you've had, I think I may have mentioned it earlier, but if you have had a severe reaction in the past to any vaccine, hold off for a moment, talk to your doctor first. And if you do decide to get it, make sure that the people vaccinating you, that whole staff knows that you have tendency for these allergic reactions so that they can monitor you and make sure that you receive all of the help that you might need with this. If it's been severe, where you've ended up in the hospital or anything like that, or you needed your EpiPen, you definitely want to make sure that's with you, first of all, but also just make sure you talk to your doctor and see if this is the right thing for you to do. Which is the other reason why so many more of us who don't have these reactions to vaccines should get the vaccine, because there will be people who can't get it. The people with autoimmune diseases, the people with severe allergies, children right now aren't allowed to get this. So you want to protect all of those individuals. Women who are pregnant may not opt to get this right now because we don't know what happens when you take it, you're pregnant, and we don't want to affect the fetus. So all of those individuals that can't get it, we get it for ourselves, but we also get it to protect them. Okay, so that's important as well.
Okay, there's a couple in the chat that says, how will you be affected? How will you be affected if with only getting one shot of the vaccine? My understanding is that all of them have at least 2 rounds, and so I'm not certain if it's one particular over the other, or is it just one portion. As we know, a lot of times, like for shingles, it's 2 rounds. The first shot, and then you come back with the second shot. It's after the second shot that you are properly vaccinated from shingles. Is that the same? Because I'm not certain how this question reads, but just in out there.
Yes, that is the same.
Okay.
So for both of these, they are you get a booster shot after the first one. For Pfizer, I think it's 3 weeks after. For Moderna is 4 weeks after. Johnson & Johnson is trying to come up with one that is not yet authorized for use, but hopefully will be soon, which will be just 1 shot. But we're not there yet, and I don't know if it will be authorized. So we have the 2 that are being used right now widely, and they both require 2. Okay, so you kind of get your immune system primed, and then you get a booster.
Okay.
Make sure everything's gone.
Now here's a good question. Are you at risk of infecting anyone in your home if you get the vaccination first and others in the home don't get vaccinated right away. My house is a classic example. On Friday, my wife surprised me and she went and got hers, which means that she has the first vaccination shot. Me and the children, we are not vaccinated, but I'm the only one in the house that had been tested several times.
Okay, yeah. So typically the answer is no. So let me say there's a little caveat here. If you, there is a small window between the time that you get your shot and the time that your antibodies start revving up. So that small window might be just a few days. You could still give it to someone if you have it, because you're not yet fighting it. So, however, there's also just a 95% effectiveness. So that means that there's could be 5% of individuals that just don't respond, as you might expect, to this particular vaccine. So those individuals as well could potentially still give it to someone if they're not fully immunized for whatever reason, and within that small window. Otherwise, you should be beyond that window. The idea is that it will be effective in 90%, 5% of people, and that you will not be transmitting it to someone else. So there is a small window, but for the most part, no, you don't have to worry about it. You're not getting live vaccine. So, live virus, sorry, in the vaccine. So you will not be able to give it to anyone.
Glad you mentioned that, because that's part of the next question. I've always been told that even when you get a flu shot, that the virus is injected in you. If this is the case for COVID-19 vaccine, does this mean that you can infect others while you wait to be protected? But I guess that's one of the things, that was one of the concerns that some people had, is that typically when you are getting vaccinated, you receive some of the live virus to help build the antibodies. But what was described in some of the town hall informationals that I've watched as well, as they said it actually is safer when they don't have to inject the live virus into your body than it is when they do. So in that line, what is your...
Yeah, so there are different types of ways that they make vaccines. And again, I'm not an immunologist or virologist, so I can tell you in the way that I understand it. So there are some vaccines like the flu vaccine, where you actually get a taste of the virus, but deactivated, weakened, not going to actually cause you, because they're not going to give you an actual virus. That would defeat the purpose, right? We're not going around giving people diseases so they can build immunity. That's not what we want to do. So even with the flu virus, it's always a weakened version of it that can't reproduce as it would out, when you just contract it normally. So with this particular virus though, and lots of the newer vaccines that they're doing, they use something called, it's using a part of the virus. So not even a deactivated or dead version of the virus, but just a little piece of it. And it's just enough for the immune system to recognize it. So if anything comes into your body looking a little bit like that structure, then your body will respond to it appropriately because it has made antibodies to that particular structure. And all the viruses are structured differently. Okay, so with this particular one, we're taking mRNA, which is part of the genetic component of the virus, the coronavirus, and you put it in a person. It doesn't have everything it needs, the full code to reproduce itself as a virus, but it's just enough of the code for your body to make antibodies. And if it sees that little piece come in that it can connect to, which is the coronavirus, it can start killing it. So that's what's going on.
Okay.
Is there another question?
Yeah, some more questions in the box. One of them I can answer. We have no idea when there will be vaccination for children and what age. That's something that they're still working on. That may not even occur this year, in all honesty. So I did, get enough information on that. The next question is will the vaccination be able to handle the new strand, because of course the new strand is out. It arrived in Michigan, I think yesterday it was identified. So we are now one of the 17 states that have the new strand.
Yeah, we have it in Pennsylvania too.
Okay.
It depends on how similar it is to the original.
Okay.
I've heard some reports that it's probably similar enough
Mhm.
that the vaccine will pick up on it and destroy it in your body, but it's unclear. And viruses mutate all the time. They mutate all the time, and there's nothing we can do about that.
Mhm.
Hopefully, if it's similar enough that the antibodies will work, that's what we're hoping. If not, then we'll have to work on yet another vaccine. That's the difficulty.
Okay.
That's the difficulty.
Now here's another question. Is it true that the vaccine, I'm sorry, could or would decrease our immune system going forward in the future? Could it have some lasting effects on our ability of our immune system to work in the future?
Not that I'm aware of. I don't think that's a concern. Our immune systems are pretty resilient for most of us anyway, unless you have some reason for immunocompromise like disorder or something. They're pretty resilient, and they work with all the different, we're bombarded with all kinds of germs and bacteria and viruses all the time, right? You've already built up some immunity to some of those. So I don't think that that's a concern at all.
Okay. Another question is the vaccine safe for individuals who have had a heart attack or stroke?
Yes, I actually read something about that. In fact, the American Heart Association recommends that people who have had heart disease, stroke, actually consider, except for the reasons that we've already stated, consider getting the vaccine because you're at higher risk. You're at
Okay.
higher risk of complications from the virus, not the vaccine.
Okay. Dr. Nelson has made a comment and said, for those who are choosing not to get vaccinated now, what can they do to keep their system strong if a person chooses not to get vaccinated? Are there any natural ways that we can boost our immune system?
Eat well, take vitamins, exercise, keep your mask on, and social distance. Hand washing, that's what we can do.
And pray.
Pray first.
Yes, definitely. One of the questions from yesterday was, does the shot guarantee that you will not catch the virus? And I think I could probably answer that. No, it does not guarantee that you will not catch the virus. The only thing it's supposed to do is to minimize the effects of the virus if you happen to catch it. Am I correct on that?
Right. So it's 95% effective. So if you do if the virus does enter your body, then you have a good chance of killing it and not sending it to anyone else, not passing it on, transmitting it to someone else. But again, there's that 5% that you have to be concerned about. And it doesn't mean, that you can't get it whatsoever, but it really lessens the chances. So that's good. Just like with all the other vaccines, when you have the chickenpox vaccine, measles, mumps, all those things, we can really decrease the risk to ourselves and to our communities when we get vaccinated.
Okay. How long does the vaccine stay in your system?
That is still under investigation. So that's one of the things we'd all like to know. And I have to say that the clinical trials are still ongoing. They started the people as soon as the vaccines were available, and they're going to be followed for over 2 years. So we don't know. They're investigating that. So that's why we don't know if you have to repeatedly get booster every year like you have to do for the flu, or if this is a one-time thing. We have no idea.
Okay. Here's another question. What does the vaccine actually do to your system, immune system? Does it make it something stronger or increase something like your white blood cells? May not, I guess the person just trying to figure out what happens.
Right. So whenever you get any vaccine, or if you happen to get come in contact with the virus, it's going to really rev up your immune system. And the white blood cells, exactly. That's what's being activated. So what'll happen is your B cells and your T cells and all of them start working to overcome the virus. And the B cells are actually what makes the antibody. It recognizes there's something strange in here that shouldn't be, and it will make an antibody to begin fighting that particular uh, uh, strange thing that shouldn't be there. So in this case, a virus.
Okay. Okay. And then, of course, another question was asked, which we don't really know, and that was basically, is this going to be a one-time hit, or is this going to be like the flu shot, where it's continual, an annual kind of thing? That's something that we don't know.
Yeah, with regard to the vaccine, we don't know, but the coronavirus is here and it's going to be here. It's going to be here.
Okay.
So just like lots of other diseases, you've seen some make a comeback because people had stopped getting their vaccinations. So it can be transmitted among those who can't get it or won't get it. And this coronavirus will be here, and it may mutate, and it may do lots of things, and it may become less, cause less severe complications over time, and it may not, may get worse. But the best thing we can do is just protect ourselves in every way that becomes available to us.
Okay. Are there any other questions anyone else have? You can put them in the chat, or you can unmute and ask the question yourself. And if you didn't get any questions out, keep in mind that we will also be blessed next week to have Dr. Betts. She's coming on, and she's going to share some possible alternatives. As we mentioned, some folks are not for medicine. I know personally I'm not for medicine. I never took the flu shot until D3 was born. And I took the flu shot because I did not want the chance of the potential of having to be sorry that I didn't take the flu shot and I possibly infected my children who were premature. And so I didn't want that on my conscience. So it was a no-brainer. I wouldn't do it for myself, but I did it for them. And now I take it because of them, because